Had this many people in our office since pre-COVID. Good. You're good? I think you're right there. You want one more? Okay. Awesome. Good afternoon, everyone. Welcome to Belmont Cragen and to the Northwest Side Housing Center. We're so excited to have you here in our office. We realize it's a little packed, but this is where the work happens. This is where we lead all of our Health Equity Zone and Protect Chicago Plus work. So we're really grateful for you all to be here today with us and join us in our office. I have the honor today to introduce the leader of Chicago who, over the past year and a half of the pandemic, has continuously demonstrated leadership and commitment to communities. It's because of their focus on equity and the Black and brown communities in Chicago that today we're going to be able to celebrate some exciting and really amazing news with you all. So without further ado, I'd like to introduce the Mayor of Chicago, Mayor Lori Lightfoot.
Good afternoon, everybody.
Good afternoon.
There's energy here. I appreciate it. Thank you, James. And I have to say thank you for all the tremendous work that you've done in this community. Many of you may remember that throughout a lot of 2020, this community of Belmont Cragen really suffered mightily, disproportionately from COVID. And it's because of the work that James and his team and a lot of other volunteers working diligently in this neighborhood in particular that Belmont Cragen is now one of the most vaccinated communities in the city of Chicago.
Right.
So that deserves a lot of applause. Today is a momentous day for us in our COVID-19 journey. And with us are Chicago Department of Public Health Chief Medical Officer Jennifer Suh, Department of Public Health Medical Director Geraldine Luna. You've met James, also from the Northside Housing Center and outreach worker Ruben Oliveras. Greater Auburn Gresham Development Corporation, in my constant running buddy everywhere I go, CEO Carlos Nelson, Westside United Senior Director of Community Engagement and Health, Ladarius Curtis, and Westside United Executive Director Aisha Jocko. Think about a year ago. We had a very different set of circumstances that we were facing. As the weather cooled down and people were poised to gather with loved ones to celebrate the holidays together, we were standing and flagging a note of caution. We were experiencing at that time a very sharp uptick in COVID-19 cases, which threatened our health and well-being as a city, and to set us back in overcoming the crisis. Back then, we didn't have a life-saving vaccine to prevent the spread of COVID-19 and these kinds of close indoor settings, which is why after Thanksgiving of last year, we saw a 30% boost in cases of COVID. Now, less than a year later, we do have vaccines and even booster shots to keep residents as young as now 5 years old safe and protected from this deadly virus. So we're here today to celebrate an important milestone in our fight against COVID. You remember that back in September, we launched a Protect Chicago 77 campaign, and we set a goal of reaching 77% citywide vaccine rate for Chicago. We wanted to make sure that we reached that number no later than December 31st of this year. Well, folks, we're here today to share the exciting update that by the end of this Thanksgiving week, we will reach this goal. And we're reaching it 30 days early.
Wow.
And we're able to reach this important milestone because of the work of the organizations and individuals that are standing with us today and a lot of other people across the city of Chicago. And as we prepare to formally celebrate this milestone, we've got to acknowledge, though, that there's still work to do. Still more people's lives that we need to save, more people that we need to reach in communities all across the city. Nonetheless, we are seeing significant progress. And with vaccine eligibility recently expanded to children as young as 5 years old, we are deepening our efforts to reach our hardest hit communities and connect them with the information about access to the life-saving and free, widely available vaccines. Protect Chicago 77, just like every other COVID-19 related initiative that we've launched, is centered around our North Stars of equity and inclusion. And that's why we'll have to continue to work with trusted local community and stakeholders like the ladies and gentlemen gathered here today to deploy tailored, specific, targeted strategies to reach people in communities, but importantly, to reach them where they are. There's not a one-size-fits-all strategy for our various neighborhoods. We know that. We've learned that through COVID. That's why working with trusted community partners is so important. And speaking of community stakeholders, there are a lot of organizations and individuals to thank for not only getting our city to 77% vaccination, but also who have been with us on this journey. This includes Westside United, led by Aisha Jocko. You may recall when in April of 2020, we learned that blacks in Chicago were dying at 7 times the rate of any other demographic. The first people we reached out to were Westside United. And the reason is because they had been doing incredible work on the West Side, building an infrastructure of community healthcare workers and making sure that they were reaching the needs of community members on the West Side. We knew of their track record and knew that we could partner with them as we stood up what then became known as the Racial Equity Rapid Response Team. So thank you again to Westside United for what you did before, what you're doing now, and what you'll do in the future to make sure that we are building a stronger and more equitable Chicago, particularly when it comes to life expectancy and healthcare outcomes. We're grateful. I also want to give a shout out and thank the Greater Auburn Gresham Development Corporation, which is led by Carlos Nelson. Again, the Development Corporation was a founding partner of the Racial Equity Rapid Response Team and fiercely advocated on behalf of the residents in that community, including allocating resources to protect their health and well-being. So again, thank you, Carlos and the whole team on behalf of the City of Chicago. I talked briefly about James and the Northwest Side Housing Center, but let me just say, again, incredible hard work through the pandemic, giving residents information, testing, PPE, and more recently, a vaccine, and mobilizing volunteers to door knock and show up at grocery stores and other community gathering places to make sure that we were reaching people where they were about the importance of educating themselves about COVID-19. So thank you again, James. We also owe a debt of gratitude, of course, to the Chicago Department of Public Health team. Fearless warriors. We stand on their shoulders. They picked us up, pushed us forward, focused on the data and making sure that we were following the data and the science throughout this pandemic. We can't ever say enough about them. Dr. Rarty is taking a well-deserved rest this week, but her team remains in place. So thank you, Dr. Sa and Dr. Luna, for joining us here today. And let me tell you a little bit more about some of the tools that have been used and really developed by the members of the folks leading our Healthy Chicago equity zones. We created Protect Chicago Plus, which you remember was an effort for us to vaccinate multiple generations within the same household simultaneously by going deep into these communities that were showing sustained high case rates. And how did we come up with this strategy? We listen. We listen in partnership with folks here in this room and develop a strategy to reach people in those neighborhoods that we were consistently seeing had the biggest challenges with COVID-19. We also created Protect Chicago at Home, which has been a phenomenal success. This is mobilizing paramedics and vaccinators to provide in-home vaccination for homebound or disabled residents and that's been available to residents free of charge since June 28th. And we're seeing consistent uptick in the appointments getting booked up right away for this incredibly valuable tool. I've been bragging about it to mayors across the country who I know are going to take me up on our offer to educate them about what we've been doing. And I got to thank Tina Anderson of the Chicago Department of Public Health who leads that important work. You should know that to date, more than 17,000 people have been served through this Protect Chicago at Home program, and more are joining the ranks. These initiatives, among others, have allowed us to reach some of our most vulnerable, vaccine-hesitant residents to build trust with them and encourage them to get vaccinated. And as I said earlier, we still have more work to do. We are not going to rest until we are the most vaccinated city in the country, and we are committed to making sure that we do that. But the fact that we reached this important milestone of 77%, and we're seeing increases really across every neighborhood in our city, that we reached it 30 days early is really an incredible accomplishment among all the people who have been out there in the streets, in the trenches, getting the work done. So this is an important moment for our city. So if you're listening, or if you're not vaccinated, or if you're listening and you're vaccinated but you know someone who is not, it is never too late. It's never too late. We want you to get yourself vaccinated because it's the only sure way to protect against the ravages of the Delta variant, which is still the predominant variant that we're seeing across our city. So, folks, go to chicago.gov/vaccine finder to find a location where you can get the vaccine. Sign up for an appointment and get it for free. Or setting up an appointment to get vaccinated in the comfort of your home, we've got opportunities for you to do that. You can call 312-746-4835. That's 312-746-4835, or also visit chicago.gov/at-home. We want to make this as easy as possible for people who have made that decision. There are a lot of folks that are still on the fence, but I know you're thinking about it and you're hearing the messaging. If you've made a decision today to get yourself vaccinated, don't hesitate. Give us a call, sign up on the website, but we want to get you vaccinated as quickly as possible. So again, thank you all so much. I want to say happy Thanksgiving to all concerned. Be careful, and you'll hear more about that as you gather, particularly if you're gathering with folks where you don't know their vaccine status or you do know and they're unvaccinated. And Dr. Suh will talk a little bit more about that. Doctor.
Thank you, Mayor Lightfoot. Good afternoon. I'm Dr. Jennifer Suh, Chief Medical Officer at the Chicago Department of Public Health. We are so proud of the efforts made within communities to help us reach 77%. And it's really a testament to the incredible work being done by community partners with whom we have been engaged since the vaccine rollout began, and to Chicagoans across the city who have acknowledged that the COVID-19 vaccines are safe and effective and have chosen to get vaccinated to protect themselves and our city. Thank you. But as the mayor noted, there is more work to be done to further protect all of our communities from COVID-19 by making sure even more of our neighbors, including our 5 to 11-year-olds, not only get that first shot, but their second if needed, as well as a booster dose for all adults, especially those ages 50 and older. We continue to see a rise in COVID-19 cases in Chicago, with over 500 new daily cases, and unfortunately, we've seen a rise in deaths as well. Now is the time to get vaccinated, not only to protect us for the winter and holiday seasons, but to also continue to move us forward out of this pandemic. So, at CDPH, our work is not done. We will continue our partnerships with local community stakeholders to develop tailored vaccination and engagement strategies to help residents get vaccinated. This includes CDPH's Healthy Chicago Equity Zones, which I know you've heard Dr. Arwady talk about. CDPH allocated $9.6 million in COVID-19 relief funding from the CDC to establish 6 geographic areas covering the entire city, led by trusted regional and community organizations. With our support, these organizations have and will continue to lead conversations in neighborhoods, build partnerships, host vaccination clinics, and more to ensure that all 77 neighborhoods increase their vaccination rates. And then, over time, the plan is to evolve their work to confront factors that contribute to the health and racial disparities that this pandemic has highlighted, including in healthcare and social service access, food access, housing conditions, community safety, and the physical and built neighborhood environment. I'm excited to have 3 of our regional leads here today, the Greater Auburn Gresham Development Corporation, the Northwest Center, and Westside United, so you can hear more about this work. These are long-term investments that CDPH is making across the city to ensure that we're protecting Chicago communities through the pandemic and beyond. Thank you, and I'll now turn it over to Nancy Valentine from the Northwest Center.
Good afternoon. My name is Nancy Valentine. I'm from the Northwest Center, Director of Health Equity, and the Regional Lead for the Northwest Healthy Chicago Equity Zone. I want to start by thanking our community for assembling and recruiting their teams and resources to be able to create the mobile clinics that we have today. I want to thank the 36th Ward for generously allowing us to use their space here in the community of Belmont-Cragen. I want to highlight this holistic approach that's composed of community residents who have done outreach, visitations, vaccine signups, and canvassing to spread the word to their neighbors. This weekend, we began vaccinating the children ages 5 to 11, and we were able to do so promptly and safely in their own community. We are excited to announce that all of our efforts have led to an 84.6 vaccination rate in Belmont-Cragen, the highest of any people of color vaccination neighborhood here in the city of Chicago. We look forward to partnering with the City of Chicago to continue to sharing access to state-of-the-art tools that help inform our work and continue informing our local government on grassroots strategies that will continue to move our health equity work forward. Thank you. I'd like to invite Ruben Olivares.
Hola, buenas tardes. Mi nombre es Rubén Olivares. Soy el gerente del equipo de respuesta rápida de aquí en Northwest Center. Primero que nada, quiero dar gracias a la comunidad por permitir que les ayudemos a mitigar los efectos que ha tenido el COVID-19 aquí en Belmont-Cragen y otras comunidades cercanas. Segundo, les quiero compartir una historia muy breve de una familia que se vino a vacunar al Brickyard este fin de semana. Era una familia de 6 personas, papá, mamá e hijos, edades de 5 a 11 años, donde los papás ya se habían vacunado desde marzo en las Steinmetz, donde habíamos vacunado más de 10,000 personas. Esta historia es muy importante porque encapsula el trabajo que hemos hecho durante este año. Primero que nada, los papás ahora están poniéndose su tercer vacuna, su vacuna de refuerzo, y los niños están poniendo su primer vacuna. Todo el esfuerzo de este año ha logrado que traigamos estos servicios a nuestras comunidades sin discriminaciones y con un proceso relativamente fácil. Por último, quiero agradecer a nuestros líderes comunitarios y a nuestros líderes gubernamentales que han hecho esto posible. Y también a todos los que han conformado parte de este equipo. Muchas gracias. Y ahora con esto, I invite Aisha Jacob. Thank you.
Thank you.
Good afternoon. My name is Aisha Jaco, and I proudly serve as Executive Director for Westside United. We would like to thank Mayor Lightfoot and the Chicago Department of Public Health for giving us an opportunity to bring together leaders serving Black and Brown communities from the following organizations: Austin Coming Together, serving Austin; Breakthrough Urban Ministries, serving East Garfield Park; Enlace, serving Little Village; Erie Family Health, serving Humboldt Park; Esperanza Health Services, serving Pilsen; Myafa Redemption, serving West Garfield Park; and the Sinai Community Institute in North Lawndale. Through the work of the Health Equity Zone and the vaccine equity initiatives that these partners collectively came around the table to implement, this would not have been possible at the magnitude and speed without the support of CDPH and us being able to leverage the important work that we did as co-conveners for the Racial Equity Rapid Response. We are honored to stand here today next to our peers from the Greater Auburn Gresham Development Corporation as well as from the Northwest Side Center. This work is very important to us in our plight to decrease the life expectancy gap by 50% by 2030, utilizing key partners, and that is well aligned with the Department of Public Health's Healthy 2025 plan, which has goals and aspirations addressing health equity related to different categories that are attainable and in reach of 2025. So in working together, it takes a village, it takes continued partnership, it takes Chicago continuing to be a leader and innovator to implement strategies that are effective across our communities, across our city, across the nation, and we are so honored to continue this work. Thank you so much. At this time, I'd like to introduce Carlos Nelson, who serves as the CEO of the Greater Auburn Gresham Development Corporation.
Good afternoon, everyone.
Good afternoon.
Oh, thank you. Thank you for that. Carlos Nelson here representing the Near South Healthy Chicago Equity Zone and all of our partners from the Near South, and specifically the Auburn Gresham community. I'm also here really to support a mayor who I believe through this tumultuous time that we're living in will have a legacy of getting ish done.
That's right.
Right? And she's not getting it done by herself. The reason she's been able to get things done is because she listens. She listens to experts like community-based organizations like Westside Housing Center, like Westside United, Austin Coming Together, Greater Auburn Gresham Development Corporation. She's getting it done because she listens to faith organizations. She listens to health provider partners, the folks that know what's going on in their communities. Mayor Lightfoot mentioned an April press conference that I had the honor of speaking at City Hall, launching the Racial Equity Rapid Response work. And I remember at that press conference, I talked about the disparity in Auburn Gresham. If you don't know, the Auburn Gresham community was the first community in the state of Illinois that was impacted by a COVID-related death. And I talked about a project that we were working on for years to bring an Auburn Gresham healthy lifestyle hub to 79th and Halsted at 839 West 79th Street. And I implored the mayor, I said, Mayor, if we had the resources to get that project done, we could have saved lives and supported families. And the mayor, through her Invest Southwest initiative, found resources to make certain that that project reaches the finish line. And I want to thank the mayor for that. So in April of 2022, the Auburn Gresham Healthy Lifestyle Hub will be open and operating for expecting to see 21,000 clients in the first year, thanks to Mayor Lightfoot. I want to thank you for that. And then as I close, in September, hosted by Teamwork Inglewood at the Red Shield Center, there was this aspirational goal of getting 77% of the city of Chicago vaccinated. And many people thought she was crazy for that. Some people still. And so, you know, yeah, we thought it was aspirational. Many thought it was aspirational, but because she listens and trusts the experts on the ground, community-based partners, community-based organizations, health provider partners, faith community partners, should we be surprised that this mayor, whose legacy will be getting ish done, has gotten that done 30 days early? So I'm really excited to be here in support of Mayor Lightfoot. And I'd like to introduce Dr. Geraldine Luna from the Chicago Department of Public Health, who has been a fabulous partner, leader for community-based organizations like mine. And I'm sorry that Dr. already is not here, but hopefully wherever she is, she's enjoying herself. Dr. Luna?
Thank you very much for those words. Y bueno, soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública, y les voy a dar estas actualizaciones en español. Hoy es un día trascendental en nuestra jornada contra el COVID-19. Estamos camino a cumplir con una meta de vacunas que establecimos en septiembre con el lanzamiento de la campaña Protege Chicago 77. Esta asegura que al menos 77% de los residentes de 12 años en adelante hayan recibido por lo menos una dosis de la vacuna contra el COVID-19 antes del 31 de diciembre de este año. Bueno, familia, estamos aquí hoy para compartir esta actualización emocionante. Al final de la Semana de Acción de Gracias, alcanzaremos esa meta. Así que felicidades. Pero mientras celebramos este hito, También debemos reconocer que todavía queda trabajo por hacer para proteger a nuestras comunidades del COVID-19 y superar esta pandemia. En nuestra ciudad todavía hay demasiados residentes que aún no se han vacunado. Y con la reciente expansión para incluir a niños de 5 años en adelante a la elegibilidad de la vacuna, estamos profundizando nuestros esfuerzos aún más para llegar a nuestras comunidades más afectadas y conectarlas con la información de acceso a esas vacunas que salvan vidas. Protege a Chicago 77, al igual que las iniciativas anteriores relacionadas al COVID-19, se centran en la equidad y la inclusión. Estamos trabajando directamente con los residentes para recordarle que la vacuna es gratuita, es segura y altamente accesible y la mejor defensa contra el COVID-19. Hay muchas organizaciones e individuos a quienes agradecer, no tan solo por lograr que nuestra ciudad tenga una tasa de vacunación del 77%, pero también por todo el apoyo recibido en este punto crucial de la jornada contra el COVID-19. Esto incluye Westside United, Greater Auburn, Gresham Development Corporation, el Northwest South Housing Center. Quedamos en una deuda permanente de gratitud con estos grupos y muchas otras agencias comunitarias en nuestra comunidad por su trabajo en equipo y dedicación para proteger a nuestros más vulnerables. Pero como dije antes, todavía hay trabajo por hacer y más residentes a quienes rescatar. Por lo tanto, si todavía no se han vacunado, les insto a que se vacunen de inmediato, yendo al centro de atención médica o farmacia de su elección, o visite chicago.gov/inclinada Vaccine Finder para encontrar una localización alterna, o programe una cita para vacunación en la comunidad de su hogar, llamando al 312-746-4835, y repito, en la comodidad de su hogar. 312-746-4835 o visítenos en chicago.gov/inclinada at home. Sigamos haciendo el buen trabajo en equipo y llevemos esta crisis a su punto final. Gracias y felices fiestas a todos. Y ahora, now I give back the mic to Mayor Lightfoot for Q&A.
Thank you, Dr. Luna.
Thanks, Dr. Luna. Thank you, Mayor. We're going to start off the Q&A, ladies and gentlemen, with On Topic. Anyone on topic? Mariano Gilis with...
Hello, Mayor.
Hey there, how are you?
Oh, you want to hold it? Okay, I was checking your dashboard, the COVID dashboard. It says that only 45% of blacks are fully vaccinated and 54% of Latinos. I was wondering if maybe it's a little too early to start celebrating.
Well, I think it's important for us to mark the occasion of overall 77%. But as I think speaker after speaker has said, nobody's taking a victory lap. And we are still seeing progress in some of those areas, particularly on the south side, where we've been very challenged. But we will continue to work with our partners on the ground there to do everything that we can to get people the information, address their hesitancy, because I think it's hesitancy, not resistance, but to get people educated about why they need to get vaccinated. And I'm particularly focused, as I know CDPH is, around making sure that kids of color are getting vaccinated at as high a rate as possible. We're still seeing, unfortunately, the same cycle where whites and Asians are getting vaccinated at higher rates than blacks and Latinx. We've got to reverse that trend because we know, based on now 20 months of experience, that it's those communities that are the hardest hit. So we're very, very focused.
Do you think there's any part of your message that it's not being understood properly by those communities?
You know, I think the answer has to be yes, and it's not just my message. Obviously, the message around vaccines is something that is talked about every single day in every medium that I can think about. There continues to be way too much misinformation out there, and there are also people who harbor, I think, genuinely believe but mistaken information about the safety of the vaccine. And we still hear from people saying, you know, well, I really want to wait and see. We're way past the time when it's safe to wait. You know, Dr. Saw gave you the statistics for today. In roughly 3 weeks' time, we've gone from cases that were in the 300s going into the 200s, now we're back up at 500. We're seeing an uptick in the number of deaths. And invariably, the people who are the sickest and the people who are dying are the people who are unvaccinated. And now that we have vaccines, which we've had since mid-December of last year, it's heartbreaking to think about the potential loss of life and the reality of the loss of life of people who are dying from COVID-19 when a safe vaccine is available. So we've got more work to do, no question about it, and we're very specifically focused on the data. We still have our big convening every week where we do a deep dive of the data across the world, across the region, the state, and obviously in city, down to zip code and block level, because that's really what it takes, and sharing that information with our partners so they can see for themselves really what progress is being made. And we are making progress, but we're not where we need to be yet.
Thanks a lot, Mayor. Sarah Schulte with an on-topic question.
Okay. I also have a question about the numbers. According to your dashboard, currently it says 67.4% have received one dose. So is that number inaccurate, or are you just projecting that by the end of the week that number is going to jump up by 10%?
Yeah, I'm not sure what number you're looking at. My number,
it's on there.
My data tells me that we're at 76.6%, which is why we have confidence that we'll get to the 77. I'm going to ask Tina Anderson to step up because maybe she knows specifically what you're.
Unless it's just changed, but I looked right before I came here, and that's what it said for one dose.
I'm going to have Tina Anderson from CDPH.
Yeah, thanks for the question. So there's a bunch of different numbers on the dashboard. The goal that we set in September was 12 and up, because that at the time was the folks who were eligible for vaccine. So it's one dose, 12 and up is 76.7%. The number that you're looking at, I believe, is all of Chicago, which obviously we have a lot of work to do to vaccinate our 5 to 11s now. And then obviously there's Chicagoans who are under 5 who are still waiting to be eligible.
So to clarify, we are at 76, counting.
So that, yeah,
for
12
and up.
More clear on your website.
For 12 and up, yeah.
Yeah.
So it's I can show you kind of what the right line is on, but it's 12 and up, first dose.
Okay, so 12 and up. I mean, if you look right at the website, that's exactly what it does not. It doesn't make that distinction.
We can take a look at it.
And also, question: Do you know how many people actually go get their second dose? I mean, because what we're talking about is 77% of people a first dose. How many people actually?
It's an issue.
You know, that's a very important issue. We know that, so in terms of 12 and older, just over 70% have received their completely completed the series. But that is an important point. We want everyone, if you are getting the 2-dose primary series for the Moderna or the Pfizer, you have to get both doses to be fully protected. If you are an adult, ages 18 and over, you are now all eligible to get a booster dose as well. And that's 6 months after getting a Moderna or Pfizer, or if you got the Johnson & Johnson vaccine, it's 2 months after getting your single dose series of the Johnson & Johnson. So very important to complete the series. So, you know, we set that goal of 77% for 12 and older for that starting the series, but we are continuing to message through our healthcare partners, through our community partners, that you have to complete the entire series. But we are doing very well. 70%, we're actually doing better than the nation-wide percentage for completing that second dose for 12 and older.
Any on-topic questions? Okay. Marianne Ahern, Channel 5.
Yep.
Mayor, can we ask you about Marine Leadership Academy? Parents say that they spoke up and no one listened. It sounds a little bit like the Park District. When were you aware of Marine leadership and their troubles?
Yeah, I became aware of it, I would say 2 to 3 weeks ago. I think that the challenge here is this. As I understand it, the CPSIG started investigating sometime in 2019, and then COVID hit, so that investigation was delayed as a result of that. I think the balance that has to be struck, and it's not an easy one, is if the IG flags there's an issue, issues don't mean facts yet. Issues are, in many instances, allegations that have not been fully investigated. So being prudent, obviously, CPS had to wait to get more information from the IG as to whether or not these allegations that were then subsequently investigated bore fruit. That came to light within the last, as I said, 2 to 3 weeks. And then when that happened, that's when CEO Martinez and his team took action to separate a number of people that either were themselves, frankly, involved in the grooming and abusing of children or knew about it, which in some ways is equally as bad, if not worse, knew about it and failed to follow their obligation as self-reporters to report the problem. So I believe that the CEO Martinez sent a very clear and unmistakable message on Friday that, A, we're not going to tolerate any kind of misconduct, certainly not one where people are grooming and sexually abusing our students. But you also send a clear message, and I think he did that on Friday. If you know about it, you better report it. You better not turn a blind eye.
I don't want this to count as my second question. How did
sorry.
COVID play a role? How did COVID play a role?
Because the reason that it played a role is, A, a lot of things were shut down. It was difficult to do, figuring out what how to do investigations remotely. That was challenging, and frankly, with some of the challenges with union representation and so forth. But the bottom line here is this. In my view, and I think the CPSIG has recognized this, they've got to get these investigations done much more quickly. Now, having gone through this experience of doing investigations in the midst of COVID, they know how to adapt. There is this thing called Zoom and other platforms where they can take witness statements, but particularly when we're talking about something as serious as sexual allegations by adults preying upon children, we've got to get it done. We've got to get it done quickly so that action can be taken. We've got to protect those kids. That's got to be everybody's number one priority.
In light of what happened in Waukesha last night, how will the Chicago Thanksgiving Day Parade, any changes for security?
Well, look, first of all, my heart goes out to the people of Waukesha. I've been to that community before. It's a great community, and it's heartbreaking to think that someone did what they did, and now what resulting is loss of life, a lot of injuries. But importantly, I was thinking, as I started hearing this news, about those children who were lined up for something fun, and it's a nice community, that their memories of this event are going to be marred as a result of what happened. And of course, whenever something like this happens across the country, as a mayor, you think, are we protected? Are we safe? And we had that discussion. You may know that every time we have a large-scale event, whether it's downtown or in a neighborhood, we block off the roads physically, whether it's with squad cars, whether it's with infrastructure equipment. We had several big events downtown just this past weekend with the tree lighting ceremony and with the parade on Michigan Avenue. Now, I will tell you, it leads to a lot of traffic issues, but we lock it down because we want to make sure that people can enjoy themselves and do so safely. So it's very hard to get to our events within a couple blocks, and again, intentionally so. But I will tell you, I've told my team, let's make sure we look again because we got a number of other events coming up. Thanksgiving Parade, of course, being, I think, the first one since the tragedy in Waukesha. But we always have to check ourselves and make sure that we're doing everything we can, even when you've got somebody clearly determined to do harm, that we literally block their ability to do that. I think we've got a good plan in place, but we'll never rest, and we're always going to be checking our safety protocols, particularly when some kind of tragedy like this happens.
All right, Craig Wall, ABC7.
Mayor, with the maps being redrawn, the Black Caucus put out their kind of general map today. It conflicts with what the Latino Caucus and then Change.org's got their own. Is it time for your administration to get involved, particularly between the Black and the Latino caucus, to try to make sure that there's a map that comes to you that will withstand any kind of legal tests?
Well, I haven't been quiet, either publicly or privately, about my own views about the map. So obviously I'm up to speed on the various caucuses and so forth. But look, this is a fundamental exercise in democracy, and democracy is about reaching compromise. People put their stakes in the ground. I don't think that was necessarily early on was the right way to go, because I think it's caused a lot of consternation and acrimony. I don't think you can draw maps for other people. I think folks have to be at the table. And so I think that's happening, and we'll see whether or not they're able to reach some kind of agreement or compromise before the December 1st deadline.
If I could just follow up, Jason Irvin saying today, that there's no way that they're going to drop below 17, black majority wards. That's a non-starter, and the Latino caucus is saying, you get 16 under our ward, and we're not going below 15, and they're only getting 14. It seems like they are,
Look, I think there's a lot of conversations that continue. I know that for a fact. But the fact of the matter is, if they don't reach a compromise, then most of the members of the city council are going to lose. Most of them will lose. Some won't, but most of them will. Because if they throw this to a referendum, anything is possible. And I don't think most members of city council want to get to that point, but they've got to recognize the art of compromise.
Thank you, Mayor. Tamam Bradley.
Mayor, let me follow up on that as well. You said it's democracy in action. Don't you think the public needs more than 8 days to review whatever map goes before City Council and to weigh in?
I've always said that. I've been very consistent for a year. I think it's been a year since we got the census results, that there are many people in communities, some of them reflected here, who want to weigh in, who want to talk about where the actual lines are being drawn, and transparency around this process is really important. So I've been very consistent with that. They've got themselves into a little pickle because the December 1st date is looming large, but people have been weighing in informal ways. I think it's important that people have an opportunity to weigh in formal ways.
All right, Amy Jacobson.
Oh, did you have a...
Oh, one second one. Sorry about that.
I did have another one.
Sorry.
State Rep Marty Moylan wants to make it a hate crime to attack police officers, increasing the penalty for such acts. Supporters cite what happened to CPD officers during last year's Grant Park protest as why they should do this. Mayor, should it be a hate crime to attack a cop?
Here's what I think, and I haven't read the legislation, so I don't want to opine about it specifically. It goes without saying that our police officers have a very difficult job. And this is probably one of the most difficult times to be the police, maybe in the history of our city and perhaps even the country. It's very difficult. I will forever be haunted by what happened at the Columbus statue last year. And so will the individuals, police officers who were hurt. We just attended a recognition ceremony where the sergeant who was injured by a projectile in his eye and otherwise got injured that day was recognized for his heroics over the course of that day. But anybody who watches that video showing these people, and I think most of them probably weren't from the city of Chicago, coming southbound on Columbus Avenue and going into that clearing and then using, dressing all in black, putting on goggles, passing out frozen water bottles, fireworks and other projectiles to be able to pelt the police with. Anybody who recognizes that we've got a problem and that a problem has to be fixed. And even stepping aside from that, we're seeing historic numbers in 2020 and again in 2021 where police officers are getting shot at an alarming rate. No one of goodwill thinks that is a tolerable set of circumstances, and we've got to make sure that we're sending a very clear message that we will hold people accountable. They need to be prosecuted, and if they're successfully prosecuted, they need to get severe penalties so that can act as a deterrent. It's really hard to be the police, and it is not fair to paint with a broad brush the misconduct that we've seen of some against the entire 12,000 plus police department. Most people that are on the job come on the job for the right reason. They stay on the job for the right reasons. We are not going to be able to have the kind of police force that we need unless we send a message that they will be protected in helping protect us. And that's not nearly enough of what's happening now. I've shown that video of what happened at Columbus, the Columbus statue. To the Secretary of Homeland Security when he came to visit. The first thing I did was cue that up for him to see. Because we need to know who is responsible for this. We still don't know. And we need to make sure that never happens again. But for those officers and their families, particularly the ones that have been injured, what do we say to them? We've got to do a better job of sending, I think, a very clear message that criminal conduct is not going to be tolerated in the city of Chicago, and police officers should be able to do their job without worrying about physical injury to themselves.
All right. Lastly, Amy Jacobs.
Hi. So some of the people that were at the Columbus Day statue were also in Kenosha the night of the rioting for Kyle Rittenhouse. A lot of people read your tweet on Friday night, the statement that you released. Do you really think that his acquittal on all charges is a warning shot that vigilante justice is now allowed? And did you watch the videos that were presented in the courtroom?
I watched. I've seen a number of the videos in connection with that case. Look, here's what I think. Obviously, a jury heard evidence and rendered a verdict. I also watched what the judge did in shaping the evidence that was getting presented to that jury. I'm an old trial lawyer, and I know when I see a judge putting their thumb on the scale for a particular result. I was not at all surprised.
What in particular did he do?
Well, the excluding of evidence, not allowing the deceased to be called victims, not letting certain charges go to the jury. When a jury, in my experience, tries to do the best they can, and particularly in a trial like this, every single one of those jurors knew this is a very big deal. And I think that they took their responsibility very seriously, given the fact that they took almost 3 days to deliberate. But they're looking for cues, not just from the prosecutor and the defense attorney. They look for cues from the judge. And that's why it's so important when you are a trial judge in any case, but particularly something as sensitive as this, you've got to call balls and strikes. You've got to be very even-handed. And you can't afford to send messages, whether intentionally or otherwise, to the jury that you have a particular point of view of how the evidence should come out. I mean, for example, I've never seen in 30-plus trials that I did as a prosecutor and several more as a defense attorney, I never saw a circumstance where the defendant got to pull names out of a hat of who the jurors were going to be that were deciding his fate. I've never seen anything like that before. So I could go on, but you get the point. The judge, in my view, put his thumb on the scale. And that's not the way justice in the United States ever should happen. And what I worry about, and you've watched the media that's happened since Friday, these right-wing, frankly, unhinged members of Congress offering an internship to Kyle Rittenhouse. I mean, what is that? A lot of other groups that, frankly, in my view, are anti-American, anti-democracy, using this as a rallying cry. Yeah, I'm very concerned about what that verdict does. Now, again, you've got to respect the jury's decision. They were called upon to call balls and strikes. I think if I'd seen that evidence, I may have come out with a different result. But let's just back up from this. Why on earth did that child, and that's what he was, child, have an AR-15 or whatever his rifle was, leave his home in Antioch and think that he had the right to go up to another state to supposedly protect the city? That makes no sense to me. And if it's a free-for-all, and everybody can simply take matters into their own hands, we're going to devolve into chaos. And that's what I'm concerned about. He had no business being there. None. And neither did anybody else other than bona fide law enforcement or property owners in Kenosha. He had no business being there.
Okay, can I ask the doctor one question? And I brought a little show and tell here. A lot of people... So we've been masked, and the numbers are going up. And all of these states around us are not masked. How can you explain to people that masks are working if they're unmasked and we're masked and our numbers are going up?
So something to keep in mind is that where we're seeing higher numbers of cases in our country are where the weather is colder. So we know that folks are moving indoors. Our southern states are still warm. They're able to enjoy the outdoors and not be as exposed. The other thing to keep in mind is we know that Minnesota and Michigan have the highest rates of COVID right now in our country. They don't have mask mandates like we do here in Illinois. So I think context matters in terms of where geographically the states are. And we know for sure that the colder weather, we're seeing that in Europe as well. The colder countries are seeing higher numbers of cases. So just something to keep in mind. But I would compare us probably more closely to Michigan or Minnesota, where they don't have mask mandates like we do here in Illinois, and they're seeing high case rates right now.
Thank you, Doctor. Thank you, Mayor. That's a wrap, everyone. Thank you very much.
Happy Thanksgiving, everyone.
Happy Thanksgiving.
Say it again. What was that?
Way to let them know the data. That's good. I didn't think about that. It's a good point.